Hello, my name is Arya Javidan, and I'm the project manager for the National Consortium of Telehealth Resource Centers. Welcome to the latest presentation in the NCTRC webinar series. Today's session is Virtually Forgotten Rural West Texas Telehealth Challenges and Opportunities and is hosted by the TexLa Telehealth Resource Center. These webinars are designed to provide timely information and demonstrations to support and guide the development of your telehealth programs. Just to provide a little bit of background on the consortium, located throughout the country, there are 12 regional telehealth resource centers and 2 national, one focused on telehealth policy and the other on telehealth technology. Each serve as focal points for advancing the effective use of telehealth and supporting access to telehealth services in rural and underserved communities. We also wanted to acknowledge Telehealth Awareness Week happening this week through September 23rd. The National Consortium of Telehealth Resource Centers, consisting of all 14 TRCs, is proud to join the American Telemedicine Association's third annual Telehealth Awareness Week. This week puts a spotlight on the value that telehealth brings to the delivery of healthcare services for diverse patient and provider communities. You can learn more about Telehealth Awareness Week at www.telehealthawareness.org. And for additional telehealth awareness events hosted by the TRCs, you can visit our consortium events page. Just a few tips before we get started today. Your audio has been muted for today's webinar. Please use the Q&A function at the bottom of your screen to ask questions. Questions will be answered at the end of the presentation. Please also note that closed captioning is available and is also located at the bottom of your screen. Today's webinar is also being recorded, and you will be able to access today's and past webinars on the NCTRC YouTube channel. And with that, I will pass it over to Derek Ramsey, Program Director for the TexLa Telehealth Resource Center.
Thank you very much, Arya. We're very excited to be here and to have a chance to present to you all today. I will get my slides up here. And of course, I'd like to start with the boring legalese stuff that today's talk is, of course, we have no financial disclosures to put out. And of course, nothing that we're presenting today should be considered legal advice. I'm not a lawyer. I know you're not.
No legal advice from me.
Yeah, so keep that in mind that we're going to talk to you guys today a little bit about some of the challenges and things that we're facing here in West Texas. I have the pleasure to introduce our presenter for the day is Dr. Timothy Benton. He's our Regional Dean of Medicine for the Permian Basin region. Not only is he a accomplished scholar, an accomplished family medicine doctor, an excellent dean, he is a man who cares deeply about his community and cares about the types of healthcare and outcomes that they receive. He works tirelessly as a pioneer to find ways to push the envelope and find ways to help people provide and get better health outcomes through access and other means. He has a great rural residency program where they're working in a lot of rural areas there where his residents are training and working in rural areas and doing telehealth. So the TexLa TRC Fit Labs had the pleasure to train a lot of his residents, and he's been a good friend of the program for many years. And with that, I'm going to let him start it up.
Awesome. Thank you, Derek. That's a very nice introduction. I appreciate that. I see that or heard Arya say that everybody is muted, but we can make this a conversation. We'll watch for the chat room, I guess, right? And certainly a conversation between Derek and I as well. So good afternoon to everyone. I am a family doctor. I have been a rural practicing family doctor before becoming faculty at Texas Tech. And I noticed the picture. You all lifted a very good picture of me. I appreciate that. I don't look quite that young anymore as I see on the screen. But anyway, to some extent, people in West Texas have been virtually forgotten. They obviously, this refers to the virtual networks and broadband. There are some areas where we do not have good access, but I think also we've forgotten them in general healthcare. And that's been, as Derek kind of mentioned, part of my quest as a family physician in West Texas is to deliver care broadly. So I started early as a program director and early in my faculty career, and then became a chair, and the last 2 years have been regional dean. But as program director, my approach was to build a network of residency and training in the rural network. I actually started that in the panhandle of Texas. So in the northern service area that we'll show you for Texas Tech, but then got transferred about 11 years ago to the Permian Basin. Permian Basin is a very unique area. This is a great and pretty picture. And it does exist looking like this, but an awful lot of it doesn't quite look like this, or it's a pretty arid and desert type region. But it's very unique from history standpoint, where it was covered in water before and left a lot of biomass. So that biomass is now petroleum. And it is the largest oil field in the United States, since they've learned how to frack and horizontally drill. So it's a very robust potential economy and financial economy, but large geography and sparsely populated. But still, those people that are there are driving a significant chunk of a portion of the Texas economy from the oil industry. We sit right in the middle of that, a regional campus of Texas Tech, the Permian Basin campus, and that is primarily located in Odessa, although we are also in Midland and Odessa. The School of Medicine, we operate, as you can see on the screen, several residency programs. Being a regional campus, we only take third and fourth year medical students. So we have the 6 core departments for third and fourth year medical students. But we do have 150 residents in these training programs, 150 residents and fellows, and are rapidly expanding.
I see a question in chat that may be related to this. They said, are there any residency programs for PMHNPs?
There are not currently at this site.
So is that something that would be of a lot of value, you think, or is that something that's more rare that you see?
I think adding that type of practitioner level would be helpful. We do have a very robust PA school in the region in the city of Midland. And so we are actively pursuing that, but we do not have the residency level. Good. Did we cover them?
Yeah, we got that one.
Awesome. So
feel free to put it into the Q&A or chat if you guys have questions. We'll love to answer them.
So this is kind of a summary of what we are and what we have staffing wise. 150 residents and fellows and about 70 faculty physicians. The challenges that we face in delivering care, and one of the reasons why we are moving into telehealth and telemedicine, is to try to address the expansive geography that we have. So there are large distances between population centers, and those population centers, as we'll see later on, some of them are very small, but even those people need healthcare as well. It is a largely rural and frontier area, expanding from Odessa out west toward El Paso and in between, down to the border into Mexico, and all of the area in between is some of it frontier really in development. There are the 2 urban centers are Midland and Odessa, but even those are small urban centers of population of about 150,000 each. A lot of health professional shortage in the area, and that does not just include physicians. It's all across the board, from laboratory tech to radiology to nursing. So a lot of challenges to delivering care with the healthcare workforce. In general, the community health rankings are low across all of that region as well. We'll look through that. And of course, rural as it is on its own is a healthcare disparity, but within our region, there are economic challenges, even though we have a vast resource for development, but there's still a lot of uninsured and also disparities between incomes.
Well, I know that Texas likes to brag about being #1 about a lot of things. this is some of the things you don't want to brag about being number one in, but
Right.
we're number one in the closures for, critical access hospitals and FQHCs, and
That's right.
in your area, how much of that have you guys seen as well?
Right. So Texas does lead the nation, right, in rural hospital closures and critical access hospitals. So immediately around us, we have not recently had closures. There were during COVID in 2020, when that hit and hospital margins got really tight, there was threat of several closing, but they did manage to make it through. But we have not immediately around Midland and Odessa and Permian Basin had huge closures yet. We have some right on the.
There's quite a few right on the edge.
And then we do have broadband access challenges. You might get to address that a little more.
Well, we're doing some of the study right now,
Yeah.
and we're working on that. And of course, Texas got the number one chunk of funds from the federal government on the BEAD funding. We got the most money of any of the states, but that also not something to brag about. It just means that we have the most disparities. We have the most people that just don't have the access. And it's when you're geographically large, but also population wise, very small. It's very difficult for them to put that out there and to get it in there. Of course, there's newer technologies and, upgrading on 5G and Starlink and satellite. And there's a lot of other things coming out there that are kind of hoping to maybe alleviate some of those issues.
Yeah. Yeah, I know there's some movement around us in Odessa with Starlink and the Ector County Independent School District. And so there are options, but even our marathon clinic, as we'll see, as I'll show you and talk about in a minute, we had a little bit of trouble getting connection started when we started that clinic. So. So a large service area for Texas Tech University Health Sciences Center, spanning from the top of Texas down to what I call the elbow or the arm of Texas, extending out toward El Paso. The Permian Basin sits about at the point of the cross arrows, and then south and west of there where the arrows cross. Interestingly, it's about the size geographically as Germany. But as I mentioned earlier, this is critical to the economy of Texas. So the panhandle area of Texas is farm and ranch, and it is the leading cattle producer in the nation. And then as you slide down south into what we call the South Plains around Lubbock, where we are now, is the largest cotton producer. And then down in my region in the Permian Basin is the largest oil producer. So huge economy drivers, as our chancellor likes to call it, food, fiber, and fuel for the state of Texas, but not only for the state of Texas, for the nation. So it's important that we take care of these rural people who are driving this vital pieces of our economy. But as I mentioned, we are highly ranked. We don't want to be highly ranked in this, but we are highly ranked or lowly ranked in primary care physician per population per 10,000 people and total physicians. So looking again at that region out in the sort of arm of Texas, the light blue on the left map shows us that we are very low in total physicians per 10,000 people. And then the other map shows a similar pattern, although a little better with some primary care physician pockets. But again, this is why we are driven to try to deliver care virtually, not only our physical presence, but adding to it and in between with virtual. As you could imagine, with that kind of statistics, our health outcomes are not the best. If you look, this is all obviously county health rankings from Robert Wood Johnson. And if you look around the population centers, the white, you can see the Dallas-Fort Worth area, San Antonio, Houston, all of that white, they do better performance than looking out west where we are a lot of darker green to the lighter green shades. Interestingly, there are a couple of pockets of white in there as well. ECT or Ector County is Odessa County, where we are primarily based. Next door is Midland County. And they do just a little bit better, 20 miles difference, but relatively similar resources. So it's not all a resource problem, but certainly regionally we are resource poor. Again, another reason for us to get into virtual care. We're trying to look at this from a comprehensive model. I won't go detail into this, but looking at health outcomes and healthcare delivery from a broader networking perspective. And some of you may be familiar with this health at home framework, where we're looking at health begins in the home and not just waiting till it gets to the doctor's office. So we're trying to figure out how to reach them at all levels. Obviously, this talk is related to reaching them on demand and urgently, but also transitioning because of the long distance travel and lack of resources, transitioning and providing care in the gaps with virtually. So this is what we look like, a little more drilled down into what our services are. The dark gray is considered the Permian Basin service area, although it crosses Lubbock, the double T north of us. We don't really reach into that area, but we certainly go south and west to a large region, even extending into New Mexico. The stars on the map show where our rural family medicine training program is. So it's in 6 counties surrounding the Permian Basin. That was my work over the last 11 years, or starting really 11 years ago and over an 8-year period, to begin training residents out in the region to try to increase the workforce and the manpower. And in my mind, what I was creating also was a physical network to, in the long run, build a virtual network onto and in between. And that is what we're launching into now.
But we're also, the idea is, I think the idea is if these residences are living and working and seeing what this life is like in these rural communities, they're more likely to practice there later when they choose their, practice.
Absolutely. So data does show that 50 to 60% of physicians stay within a 50-mile radius of where they graduate their final training. So that was the idea behind creating this rural program, is to try to get retention of workforce, primary care workforce in the region. It's been moderately successful. We've had about a 30% retention rate from the graduates over a 6-year period of time. So it is helping out. But this is our physical network, so to speak, in which we are now layering into a virtual network.
Oh, we've got the video here.
So this is one of our initial pieces of work going into the city of Marathon. The city of Marathon, the bottom picture, there is a building that they had, but they could not staff it. And so I got together with a community leader, and they staffed it with community volunteers. And then we provide physician access through that. And that is something I hope to repeat to you over and over. That was the theme of creating the rural residency, is private university partnerships, community partnerships. So this is the model we're pursuing in building our telehealth sites.
And we're very happy that you reached out to TexLa to get a little bit of help with some of the technology.
Absolutely.
Some of our staff have driven from Lubbock to Marathon and back in the same day, which, if you don't know how far that is, it's a good drive. So it's a fun drive. So we're appreciative to that. We're gonna see if this video will play for us the way it should.
People that move here are hardy people, so we know how to take care of ourselves, but also we're hyper aware of each other and who is in need, because we rely on each other. Watching the healthcare situation out here, understanding how hard it is for doctors to be here.
Oh, I messed it up. I'm sorry. Restart.
Take care of ourselves, but also we're hyper aware of each other and who is in need, because we rely on each other. Watching the healthcare situation out here, understanding how hard it is for doctors to be here. It's just difficult, and health is important. Health is important to the community. Telemedicine was just like you just heard a little bit about it 6 years ago. And I just felt like that was the way that we had to go somehow. So I started knocking on Texas Tech doors, and someone gave me Tim Benton's name.
One day I was sitting at my desk and the phone rang, and it was Marcy Roberts. And Marcy Roberts, being a leader in the community marathon, was looking at how do we get health care in a small community. We began exploring and brainstorming ideas of how to deliver care. So we began exploring the opportunity of telemedicine. They had a facility, but they just couldn't put a person in there all the time. So we thought, well, let's put a virtual person in, put a virtual doctor through telemedicine. I think Marathon is an example of why we need telemedicine and telehealth delivery throughout the region, certainly in West Texas.
It allows you to have a doctor's appointment Monday through Friday, 8 to 5. All of that actually is giving us better access to care than what we had before.
Marathon is a great example, and really to me has always been a pilot experience. If we can perfect this in this community, then why not multiply it and expand it throughout multiple communities in the region, and even throughout Texas.
What I find interesting about that pilot is, Marcy, that helps to run the clinic there, she's not a medical provider. She has no medical background. I believe she's a real estate agent.
Right.
And she became what we now call a digital health navigator.
Yeah.
She's someone that helps people to get in and get the equipment working and see the doctor and provide that. And that's an important missing piece in a lot of telehealth, telemedicine, in these small towns. Like, they don't have enough support so they can figure out, how do I get an appointment and how do I do some of those things? So before we even started really working on that concept, we were already sort of trying that out, or already sort of doing that.
That was a methodology really I've used over and over to build that rural training program and to build community partnerships across the board. And so I think that's what we're going to have to do in West Texas, because we are really resource poor currently. So it's very critical. But what's amazing is these people can do it, right?
Yeah.
Real estate agents and so forth can. So we are trying to replicate this model over and over. We recently gone into the population area. I guess it's a town of San Vicente, the population of 280, which is way down close to the border. Quite a distance drive again from even where we are in Odessa. And it's within the Big Bend National Park. So we did a little survey. This is not, statistically significant or analyzed in small number, but it's a very interesting result looking at what the community thought about us potentially putting telemedicine in there. And so we asked them a few questions. So you can see in the first, they recognize it's a long distance drive, right? And I think that's important for all of us to see of how expansive the geography is in West Texas. They also were not aware of what could be provided through telehealth. So I think there's a lot of education that we need spreading through the rural communities to develop acceptance in the telehealth. So they would consider that as very helpful, having that type of access as well from the survey. So just some interesting perspective of what the community.
Well, looking at like San Vicente and Marathon,
right?
Those are right there on the border. Are there different or varying types of health concerns or needs that those people have that you may not see in other places in the Permian Basin or up here in West Texas?
Sure. So they're going to be very different culture, right? And I don't necessarily mean by
even by Texas standards,
right.
A lot of different cultures within Texas.
Right. And so the cultures all across the Permian Basin are different from community to community. So I think we are going to have to adjust our programs with each one. I think once you've seen one, you've only seen one, and we're probably going to need variations of the model of Marathon. But I think it needs to be community oriented and patient-centered from design, which we're going to see a little bit later in some of the literature review. So again, this is looking at West Texas, so you can see fairly deserted looking areas, but these small population centers, and they are far from large population centers and healthcare access. These are current places that we are working with. Terlingua is a population of 127. We're looking at putting a fixed site like Marathon there. And then also in Balmorhea, a population of 398. It doesn't look like the desert. There's one oasis in the desert where there's a natural spring that brings this little lake up to the surface.
I swam there when I was a kid, and it's beautiful.
Yeah, pretty nice. And I hear it's pretty even temperature in the water. So
Yeah, even in the winter.
And then the other two places in Garden City, we've connected with a Catholic church through our Medicine on the Move program, the van. And what the van does is deliver telehealth equipment to community centers where we can set up temporary primary care clinics and create access points to care. So we're partnering with the St. Lawrence Catholic Church in Garden City, and then Kainosa, we're also partnering with them and with the involvement with the county court and using a community center or county building with them. But we deliver the telemedicine equipment through our van program of Medicine on the Move. So this is these are our two models of delivering care virtually. We think that, we bring a lot of assets to the table from the medical school in the Permian Basin.
We got a question coming in.
Okay.
It says, this is a really great program. Thank you. What do you think policy advocacy are needed to help support the expansion and sustainability of these programs and partnerships?
I think a big key to that's going to be payment models into the future, right? Trying to figure out what CMS and how Medicare is going to go and the federal government's going to go in payment models.
We're talking about value-based versus fee-for-service.
Right. And then as we get into that, I think that's going to be even more challenging. But right now, just in fee-for-service, right, we're after the pandemic, as we come out of the public health emergency, what's the government going to do in payment models? Obviously, they've been extended pretty much the same, except for telephone, right, through December of this year, but expect changes again next year. So financing it will be a challenge. I think we need policy, and I know our state, and I know through your work, we need to address broadband issues to be able to deliver this care. Sustaining it too, actually, ultimately, you need people. So we have to continue to recruit people to be providers on both ends. But this is why my model of the community engagement and the private-public partnerships. So I think that can help us as well.
But I'm jealous of the policy that we've seen in Louisiana, where they're able to bill, community health workers can bill.
Oh, yeah.
And they are able to get them out in the communities, and that would make a huge difference, because
Absolutely.
the one thing that we have a lot of culture in a lot of different, you could drive, an hour to a different city, and the culture of that city is very different. Amarillo and Lubbock and Odessa, Midland, and all of the small towns have their own sort of thing going on, but we all have in common is we're all pretty fiercely independent.
Yeah.
And very proud of where we're at.
The West Texas spirit.
And we have that West Texas spirit, is a spirit of independence and a lot of pride in where you come from. And being able to have people from their own communities being the ones that bring the message of what this is and how it works and trying to help, that's an issue that, we need that. And so it's hard to pay for that. But if we had some sort of advocacy towards being able to help get those either digital health navigators, community health workers out there,
Absolutely.
that would go really far.
Those people would be tremendously helpful in really scaling this kind of an operation where we could have community health workers. So if there could be funding sources like that for them, that would be tremendous. So our School of Medicine has these resources in the big city of Odessa of 150,000. Yeah, but the surrounding region does not have all of this. So virtual or telemedicine is a great approach to delivering this type of care. So we have plans along the line of expanding these opportunities. The other thing that we're venturing into is a school-based telehealth network. So we did write a project for the U.S. Congress, got some funding through that. It will primarily start out as a primary care base. So you can see in the top left of the map, Odessa and Midland, where we are based. And these are the schools that we have targeted in rural areas and a lot of health professional shortage area out this way. Some of these communities do not even have primary care available. So we're going to try to approach the health system science and health system improvement through a school-based network and include mental health within that. So I think maybe I've kind of covered all of this as to why we're doing this. I repeated it a lot in regards to limited resources. But it's really my drive and my passion that these people no longer be forgotten. As a rural practicing family doc for a number of years, I know there's a lot of need, and I think the university and the medical school has great opportunity to provide that for our cities and for our communities. So,
Well, and then, part of the issue there is we do talk about access, and that is important, but my father-in-law is a farmer, my wife's family is all farmers. A couple generations ago, my family was all farmers, and they're notorious. Texas farmers are notorious for not coming to the doctor,
right.
and agricultural, and
Right.
also we've got a lot of people working in the oil field. They're notorious for not going to the doctor.
Right.
And part of that is they don't have access to very good insurance because they're usually self-employed, and they don't have they're unsure as they don't want a big bill. They don't want to, so I think part of that is that part of it's the difficulties. I could see, putting telehealth clinics in places like the cotton gins and the co-ops where they're going in there to have coffee and talk. And it's sort of a lot of them, I've gone out to them for broadband, looking at their broadband, and they have good internet on their backbone, their community center. Some towns have a co-op or a gym. They don't have a school even. They don't have any other place. And it's sort of a trusted environment. And maybe we can get a couple more farmers to actually say, well, does this look infected?
I think that's the whole point of it, right? Is let's go to them, right?
Yeah.
And let's meet them where they are and try to meet their needs where they are. But also you made a great point. I mean, some of these places and some of these farmers are in such rural areas, there aren't even community centers to necessarily set up. So that's part of why we are also offering the mobile program.
We got
even in between.
A good question came in. I know the rapidly changing reproductive healthcare landscape in Texas, and also I would say maybe a lot of other states, is making OB/GYN providers leave the state, making it difficult to recruit new providers through residency programs. Is that affecting, how does this program address those challenges and specific OB/GYN shortages?
That is a great question. It is a big challenge in the state of Texas. So I think in the previous slide, I mentioned we had maternal fetal medicine, really very fortunate to be able to have 2 maternal fetal medicine physicians in our practice. So that service we can offer, but we too are even struggling recruiting OB/GYNs in the current, say, legislative market, I guess, right? And some struggle in training them, right? Because the requirements for their training can't be fully met in the state. So we're having to send them out for rotations for those who want that type of training. So it is quite a challenge in the state of Texas. Here at the telehealth conference this week, had a lady from Brady, Texas, come to me and say, "Hey, we are desperate for OB/GYN physicians." So great question. We are challenged by OB/GYN physician issues as
We are
well.
a little bit of maternal desert in our area. That's
right.
one area I hope there was some telemedicine, but also working with some OBs. I mean, that is an area of telemedicine where it requires a little more training and a little more to do their work through telemedicine. It's a little harder sometimes to do their work.
So we actually in frontier rural West Texas Permian Basin, there's still a fair amount of obstetric care provided through family medicine. So that is still going on and pretty good, but we need greater help and more physicians providing that care. Maternal desert is a pretty good word.
How many babies have you delivered?
I haven't delivered
Okay.
any in a while. I decided the malpractice insurance wasn't worth it for my practice at the time. So I did a little just limited and brief literature review, kind of trying to look through the literature as to to address our problems and see if others are having similar problems, and to see how to guide and direct what we might be setting up. So it was interesting work here, 2021 from Butzner and others on telehealth interventions and outcomes across rural communities. And in general, amazingly well accepted, even for those farmers out there. So acceptability and increased satisfaction actually, and lower healthcare resource utilization. So intriguingly, some physician recruitment and retention because of the opportunity of telehealth. So I think that makes life better on the physicians as well. PCORI has done a number of studies on telehealth, and 89 of those studies on the effectiveness, but 41 particularly related to disparities. And since rural healthcare or rural population is a disparity group. But I thought this was pretty interesting. We started off sort of unknowingly in this public-private partnerships and community partnerships. The PCORI studies are showing that patient-centered design and being culturally tailored programs are much better and better accepted. So we are approaching it from that standpoint as well. Ran across this that Canada and Brazil have some expansive geography as well, and they are laying out some telehealth programs and have been successful in spreading throughout large regions and offering services, primarily subspecialty services. But interestingly, they have some legislative and policymaking factors that slow down their progression in their programs. And school-based telemedicine, bottom line is it can work. And in this particular study, reduced emergency room visits for those kids in rural areas. So it can save some healthcare cost.
The good news from our broadband project findings so far is that in Texas and in the areas that we're looking at, West Texas, schools generally have great internet. We were very forward thinking years ago.
Yeah.
And they have access to high-speed internet. They have access in most communities, even the very small communities that we're at that have 100 or less population. The schools there have access in the regions that we've studied. We're hoping to expand next year. We'll expand to 199 counties. So right now you're going to get a larger cross section next year, and we hope that it holds up there too in different regions. But that is an area that I'm really focused on, because I know that schools are a great way to get into a community.
Right.
Because a school touches everybody in a community. I mean, that's a great way to kind of look at.
That's why we're looking at that. And a lot of these communities that we have in frontier rural West Texas and the Permian Basin, the school is really, truly the center of the community.
Well, Friday Night Lights is really about,
Well, yeah.
if you've ever seen the show Friday Night Lights, it's about the
In
Odessa, Texas region. And Texas is famous for their Friday Night Lights, but it's a whole culture around that too. So
Right. Football and school.
that's right.
Well, that's all I have, Derek. I hope that was helpful.
Yeah, I'd like to see if we had any questions for
more
anyone in the
questions out
audience.
there.
Guys can put it in the Q&A there. I know that we're kind of muted here, but we're doing pretty good on time too. Well, I will say, I want to thank you for your pioneering spirit and for your willingness to not wait for the perfect model,
Yeah.
to just go and find out what works and make corrections and be iterative. And that's a very good approach that I find seems to be a very effective approach, is that we're going to go out and try things. So
Sometimes I wonder if it would be easier to wait until the technology caught up, because like the marathon setup, we don't have the full operational digital front door, right?
Yeah.
So we still have to do a little bit of paperwork in an old fashioned way with fax machines and.
Yeah, they're going to the library to get faxes because they
That's
couldn't,
right.
we've had to worry about
But
that.
here's true community spirit. I'm at risk of, well, I'm gonna tell the story anyway. To get an appointment, you actually go to the local liquor store. So only in West Texas could that happen. So you go there and get an appointment and the community rallies and meet you at the clinic.
Well, that's a
So,
community center. So I mean,
community spirit.
so I've got one here about school-based telehealth. For school-based health centers, are you looking at primary physical health? Or are you also including behavioral health services?
So yes, we are including behavioral health services, and actually from TTUHSC School of Medicine already, we participate broadly. Well, Texas has an entire
The cater and
program.
T-chat.
cater and teach at. And we already participate in many of the schools in our region through that program. But this will expand that through our psychiatry department in the region, in our psychiatry residency. We will offer behavioral health.
I will say that the Texas cater and T-chat program, within 5 years, will serve every school in Texas, every public school. We get free behavioral health services. It's a great program. It's considered maybe one of the leading in the nation. We've seen a lot of movement in that area, so we're very passionate about that. And then I'm also love to see some more follow up on the physical health and some of that as well. Other question was, in addition to schools, in your experience, what are other ways to connect with the community? How are you guys connecting with your community members?
So I'll connect with anybody. I pretty much talk to anybody in whatever community. I think churches are another great resource. A lot, certainly in our region, most all of these communities have a church. So we connect. Yeah, or several, right? So we do connect with them. In our sort of larger ones, we connect with the health departments. So some of our health departments are small, right, and do not have full breadth of services. So we connect with those people. Connecting with the county community centers and commissioner courts and political officials, I think that's a way to kind of get in the door as well.
I have another favorite way I like to get involved in the communities. It's been working really good for our broadband project and some of our outreach, which is that when we go out to the communities, we bring our Texas Tech branded vehicle. We have our Texas Tech branded stuff on, and that gets a lot of eyes on you. People start wondering, hey, Tech's here, what are they doing here? We go to the local barbecue place and have a meal, and people will come up and talk to you. They're very friendly, and you get some conversations going, and people start asking. We went to one place though, and she said, well, what did she do? I said, what do you mean? You coming to bring my daughter back? She thought thought her daughter had got kicked out and we were bringing her back. I said, no, not this time. So, but yeah, I will say we probably could make a map of all the good barbecue in West Texas based on how much we're out there on the miles.
Sure.
Let's see. Another one here from Ms. Woods there. Were there any lessons learned that may apply in a rural setting in regions like West Africa or other regions? Yeah.
That's a tough question for me. I'm not sure. I'm not familiar with West Africa and other regions.
We had some great presentations about 4 or 5 people that had done a lot of work in Africa, West Africa specifically, at our telehealth week this week. So I'm sorry that we wish we were those people today, because they gave some great presentations on it. They talked about their work out there. I think a theme that they talked about was they had to go to each community and treat each community as its own. I think that would probably be applicable to the way we do things. You got to go out and do that, and you've got to listen. You can't say, well, you're a small town and you're a small town, so what works for you works for you.
A lot of listening.
All right. Any more? Anyone else? Well, I'm looking forward to seeing what the future holds. I'm looking forward to seeing if you're able to grow this to even more locations, even more. We're always on board to help. So if you need anything, you reach out. TexLa would love to help you some more on it. And
I appreciate what you do and appreciate your support.
Yeah. All right.
Thank you, Derek, and thank you, Dr. Benton, for your presentation. I'm just going to bring up our closing slides here. Just a reminder that our next webinar will be held on Thursday, October 19th, and that will be hosted by the Southeastern Telehealth Resource Center on their Southern Regional Disaster Response System. Registration information is available on the NCTRC events page. And lastly, we do ask that you take a few short minutes to complete the survey that will pop up at the conclusion of this webinar. Your feedback is very valuable to us. Thank you again to Dr. Benton for his presentation today, and to Derek and the TexLa Telehealth Resource Center for hosting today's webinar. Have a great day, everyone.